Welcome back, class, to our last lesson in this chapter 3 regarding being a health-conscious consumer. And this last piece is about understanding public health services. So there's quite a few services provided to you, and we're going to take a look at those different services and how you can best utilize those services. For this section, you're going to analyze the impact of the available health services in the community as well as in the world. Explain the benefits of positive relationships among community health professionals in promoting a healthy community. And then assess the impact of economic conditions on community and world health. Not everybody has the same type of economic conditions, and we'll take a look at the differences and how that affects the ability to access health. Public health. What is public health? Well, all these words kind of go into public health, taking care of yourselves, chronic diseases, injuries, sanitation, education, toxins, economics, social policy, air, drinking water, vaccines, obesity, all these different pieces go into what public health is. As a definition, public health is a community-wide effort to monitor and promote the welfare of the population. Well, there's a couple different levels that deal with public health. First off, we have our local level. These would be places that just take care of health in a particular area, like the Greater Green Bay area. There's also going to be the national level. So this is the National Health Council. That's one example. It takes care of at a national level. And then we've got the global level all the way throughout the world. This is the World Health Organization, WHO. And so they look at health and health policies throughout the entire world. Let's break down each of these a little closer here. State, county, and city health departments. Here's a card for the Brown County Health Department. This is something that this phone number here, if you needed to call, if there was, say your neighbor isn't taking very good care of his kids. Maybe you see the kids oftentimes running around in dirty diapers, things like that. It might be good just to contact them and say, hey, just for the safety and sake of our neighborhood as well as our neighbors' kids, could you maybe contact them and have a chat, those types of things. So that's who you would call regarding health departments, regarding health issues you might notice in your area. In addition, we've got disease prevention. There are places you can go to help with that or get checked out for that. They also are in charge of overseeing water and sewage. So the Green Bay Water Utility is the one that's in charge of taking care of the water in the city. When you turn a faucet on, when you live in town here, that water has to go somewhere. When you flush a toilet, that water has to go somewhere. And the Green Bay Water Utility takes care of those two pieces. There's also getting rid of waste. So we have Green Bay Waste Disposal. I think that's the name of the company. But they will take care of garbage. And so for me, my garbage day is on Thursdays. Except every other Thursday is also a recycling day as well. So we have a recycling can and a garbage can. And the Green Bay Waste Disposal is the company that comes in, collects those up, and then makes sure that those waste products are properly disposed of. And then there's also sanitation of restaurants. So at the local level, you'd kind of this organization be in charge of making sure restaurants are up to code, as it were, so they can get rated A, B, C, or get closed if they don't meet the certain necessary requirements for code for their city. Moving on to the national level. At the national level, we have a couple different organizations. First, we have the National Cancer Institute, the NCI. They're the Institute of Health, and you can look them up at cancer.gov. There's the Environmental Protection Agency, the EPA. You may have heard some things about them in the news periodically. They work to keep the environment clean and healthy. It's a nice organization that allows for us to just care for the earth that God has given us, to take better care of it for the long run. There's also the Occupational Safety and Health Administration, also known as OSHA, OSHA. This is an organization that works to keep people safe in their jobs, so occupational safety and health. So this would be like making sure that if you're working in a warehouse that people have to wear helmets or some kind of headgear, making sure that people have good understanding of how to use ladders, those kinds of things, proper protocol on dealing with chemicals. All of that would fall under the OSHA administration. There's also the U.S. Department of Agriculture, the USDA. USDA is in charge, national level in charge of helping to take care of ag and agriculture in the United States. And then there's the Food Safety and Inspection Service, the FSIS, which is kind of a branch of the USDA. And they work, again, to make sure that the food that we have and the food that's produced is safe and good for people to eat. Oftentimes you'll hear about things like lettuce or, celery, things like that being recalled because of E. coli outbreaks. It's usually the USDA and FSIS that works to gather that information to be able to alert people on a national level when their food may not be up to standard. In addition, we have some Department of Health and Human Services, Centers for Medicare and Medicaid Services. So individuals who have Medicare or have Medicaid can go to these places to get the help they need regarding how to utilize their health measurements. Food and Drug Administration, the FDA, we talked about this a little bit earlier. They're also in charge of helping to make sure that food is to a good standard and that drugs that are being produced by pharmaceutical companies are safe for people to use. The National Institute of Health, NIH, it's another national organization that works with the health of individuals. Substance Abuse and Mental Health Services Administration, the SAMHSA. This, again, kind of like the title says, it is to help people who are abusing or addicted to certain substances. CDC, Centers for Disease Control and Prevention. These are places that work to keep people safe. They work at locations where there might be outbreaks. For example, over in the West Coast near, I think it's Washington, there's kind of starting to be an outbreak of measles. I'm sure that the CDC is probably involved in that area trying to control and see what's going on with that measles outbreak. And then the FTC. FTC is a Federal Trade Commission. They also work to make sure that people are getting the appropriate health services and human services that they need. Lastly, on to the global scale. So on a global scale, we have global health, some issues that people have, things like starvation. Here are some young children who are suffering from starvation. Poor sanitation. Here's a young boy who's wading through this sewage and septic looking water, trash, uncontrolled disease. So you notice in the pictures here, a lot of these places are not places you'd necessarily see here in the United States, but they're in places that we call third world countries. Organizations like the World Health Organization work to try to help these countries to be able to improve the health of their individuals. There's also an international committee of the Red Cross that does this as well. So the Red Cross, while they're in charge here in the U.S. a lot with blood donations and blood drives, also work worldwide to help take care of people throughout the world. So you can kind of see this just an overview of the different layers of help that are available to people regarding health services. So first off, define the term public health. What is public health? Review question number 2. What effect is a poor economy likely to have on a community? Second half of the question, what effect is a poor economy likely to have on world health? Number 3, list 2 organizations that work to maintain world health. There are about 6 that we took a look at. Number 4, why might restaurant inspections be handled by the government agencies rather than the restaurants themselves? So what might happen if the restaurants only had to review and look at themselves? What would happen? Number 5, analyze the impact of the availability of health services in the community and the world. So how do health services impact both the community and the world? And that is it for Chapter 3.4, or Lesson 3.4, and Chapter 3 about being a health-conscious consumer.